And for those people, the effect is to cause horrific suffering for some people, to some people akin to torture, as against the objective of protecting the vulnerable, which they're not, as against the objective of preserving life, when for them, life is worse than death.
So that is the issue before the court at the moment. It's been an issue before us here in Canada for some time, and now comes to the Supreme Court for the first time in a long while. And joining us to talk about this for a couple of segments of the show, Dr. Paul Saba is in Montreal, and here in the studio with me, Alissa Golob with the Campaign for Life. And Alissa, I'll start with you. Just in those last comments, this is what you see. If you're against legalizing assisted suicide, you just want old people to die in pain.
Yeah, absolutely not. I mean, it's interesting because we see the comments from the lawyer Joseph Harvey, who's talking in response for the BC Civil Liberties Association. And one of the things that he says, one of his main arguments, is that doctors or physicians will be reluctant gatekeepers to physician-assisted suicide and euthanasia. But when we look at the precedent set in other countries like Belgium, Switzerland, you can have or request euthanasia for anything, even something as simple as depression. And you know, we see this because we see loved ones coming out with their stories, with their testimonies, where their mothers or sisters or brothers are depressed for a year, 6 months. They request euthanasia, and they get it, and the siblings or kids aren't even notified.
Dr. Paul Saba, how do you respond to the assertion that if you're against assisted suicide, that you don't care about the pain and suffering of people at the end of their life?
It's clear that in Canada, about 70% of people don't have access to palliative care, so that these people will suffer, and the solution is to provide palliative care for the population. And as you can see in the polls, a large number of people, when they're asked if you're suffering unbearably, do you want a doctor to help you out of your suffering? For them, the only solution is to be euthanized, where in fact that isn't the solution. It's like saying the way to treat people who have Ebola is to euthanize them because they're suffering, because they're bleeding and they're in terrible distress. The solution is to provide them quality care. For people who are truly at the end of life, they need quality palliative care. The other issue is that the proponents for euthanasia and assisted suicide are opening the door to abuse, to people dying who shouldn't die. We know that there's errors in diagnosis in severe diseases, up to 20%, between 10 and 20% in American studies. Half the time, doctors are wrong in prognosticating who's going to die over the next 6 months. And in the study in Belgium, which was published in the Canadian Medical Journal 2010, 32%, about 1 in 3 people, were euthanized without either their consent or the consent of their family members. So people say, well, I don't care, it's my right. Well, you know, your right should also, your right ends where a danger happens to your neighbor and your loved one. We know that we don't have the right to scream fire in a theater because people will get stampeded and die. And if we open the law to euthanasia, we're going to have people dying who shouldn't die, who don't want to die.
Well, Alissa, would you be okay with it if we said we will have authorized legal assisted suicide when it is obvious that the person cannot recover from a physical ailment, not because they're depressed, but because they are in fact going to die?
Well, I think that we definitely need to eliminate suffering and not eliminate people. And like Dr. Saba said, that we need to have the best possible palliative care before even discussing this. So if Canada doesn't have the best possible palliative care, then we shouldn't be discussing euthanasia as eliminating the problem, but rather easing the suffering through different medical means.
Why do you think, Doctor, it is that people are not sort of joining up with this argument that you've made? Let's get the best palliative care before we talk about anything else.
Well, it depends how you ask your question. Even I'm tempted to support euthanasia with the way they ask the question. They say if you're suffering horribly, unbearably at the end of your life and you're screaming in pain, practically, you have this image of suffering, there's nothing else to do but to take a lethal injection. Whereas in fact, we do have an alternative, which is quality palliative care. And even if we have to increase the doses for somebody who's conscious, which ends their life, we accept that as part of palliative care. Euthanasia is not a medical care. over 9 million doctors of the World Medical Association in 100 countries have prohibited euthanasia because of the abuse, because of the danger, because it's ethically unsound. And any judge or anyone who supports it, given the statistics of what the errors in diagnosis, prognosis, what's happening in Belgium, where abuse is clear and rampant, despite a country that's basically based on law, with very strict, circumscribed laws on this, on euthanasia, and it's even stricter than the Quebec law. Because Quebec law, they talk about end of life. They don't even talk about terminal disease. We're going to have an open bar to abuse, and any judge who has a clear reasoned thinking would never accept this.
Well, 20 years ago, right to die advocates say, when the last decision was made by the Supreme Court, the legal and moral landscape in Canada was different. Well, we'll talk about whether we think that's the case coming up next on Straight Talk.
I don't know that we ever say that the fact that you're singling out that the effect of this law is on a single group makes it discriminatory isn't the question. The question is, does it disadvantage members of the group? We have never said that a facially neutral rule which applies to everybody is therefore not discriminatory because it affects everybody.
I'm not saying that that's the whole analysis, that it affects everyone and therefore it's not discriminatory. What I'm saying is when you take all this context into account, this law is not discriminatory.
Back in 1993, the Supreme Court in Canada took this issue up, the issue of assisted suicide. The complainant in the case said that it was against her civil rights. In a 5-4 decision at that time, the court ruled that, in fact, the law did violate her rights, but overridden by the principles of fundamental justice. And now, 20 years later, as the court at the moment considers assisted suicide again, the argument is being made that the legal and moral landscape in Canada has changed and the law needs to change with it. Dr. Paul Saba, has the legal and moral landscape changed?
I don't believe so. I believe that the pro-euthanizer, the pro-death people have really manipulated the population in the way they phrase questions. When you read a question for unbearable, no remedy for the suffering, of course people are going to sign up. There's no alternative. But in fact, palliative care has shown clearly in 100% of the cases to get rid of physical pain, and we can help support people psychologically and spiritually at the end of life. And this is where where 70% of people don't have access. So of course people say, well, what's the alternative? Is it a fair choice to give people either you're going to suffer to death because we can't give you quality palliative care, or we'll give you the needle? So the moral landscape hasn't changed, just the way that the marketing people for the pro-death people have gotten very good at promoting their product, which is death. And the people who are defending life, and the majority of physicians are opposed to euthanasia because we're there to cure, sometimes to treat always, and to alleviate always. And so this is the problem. And the other issue that we have to constantly bring up is that people who don't want to die, because the big argument is my autonomy, my right to choose, well, you're not going to even have a choice because you're putting your life in the hand of a state apparatus. Doctors work for the government here in Canada. We're paid through the public system. We work under publicly funded hospitals. There are going to be pressures by the medical profession to get rid of people in a nice way, because we'll have them sign papers. We'll influence them by saying, you know, your prognosis, even though we don't really know what the prognosis is, it looks very bleak, and we'll make it painted bleaker, and often doctors do paint a very bleak picture. We're not even sure of your diagnosis, where we're 80% of the time we're right, 80 to 90%. And you know what? Sign right here, and we'll euthanize you, and you won't feel any pain and suffering. And we're not just talking about people at the end of life who are 99 years old. We're talking about people in their 20s and 30s who are faced with a life-threatening cancer, for example. And we know that already the governments are cutting back on new cancer treatments. Here in Quebec, the province I live in, 2/3 of new cancer drugs which have been proven effective have not been, aren't allowed on our drug plan. So people are saying, you know what? I'm sorry, we can't provide you the drugs, we can't to treat your disease, we can't even provide you palliative care to help your suffering, so sign here. Is this fair?
No, it isn't. And Alissa Golob is here from the Campaign for Life. And some of us in the media, Christina Blizzard in the Toronto Sun is very good at this, will take up the cause of families who have young people who have health care needs and they're getting the cold hand from the government. And we have to profile their case and fight in order for those people to get care so the kid doesn't go blind or whatever the situation might be. If we're in that situation, how much temptation would there be for people who run big, expensive health care operations province to province to say, grandma's dying anyway?
Yeah, I think
she's too expensive, grandma.
I think that for every, situation that comes before the court where you talk anecdotal that talks about a specific situation, there's 10 situations where there's abuses and euthanasia and physician-assisted suicide. And I think one of the best arguments against it is just looking at what happened in Switzerland with the slippery slope. They legalized it for same reasons, same compassionate reasons. Then in 2007, they said, well, it's for also the people who are mentally who have mental issues who want to die, and now it's tourism for for suicide there. Not to mention that in Netherlands and in Belgium they also decriminalized suicide for children and infants.
Recently.
So we can even go that far. So for all these different cases, there can be so many others where family members have suffered by euthanasia and physician-assisted suicide because of this.
Recently, in the last few weeks, I've had the opportunity to talk to 2 different women who at one time in their life did try to commit suicide. And frankly, they didn't because they didn't know how. They couldn't competently do it. They didn't kill themselves. And but the fortunate thing out of that is that they are alive. And in both cases, they told me they're glad to be alive. And in both cases, they told me had assisted suicide been available and a competent physician would have been available to peacefully put them to sleep, they would have done it. And I'd never have had those conversations with those women who are now doing great things and are happy in their life. And Dr. Paul Saba, are we right to be worried about the slippery slope? Would we go from the most extreme physical pain case to all of these other things Alissa and I are talking about?
Yeah, absolutely. And in fact, Quebec has already passed a resolution by the Human Rights and Youth Protection Commission to extend euthanasia to children. They passed that even before the law was passed, so there's going to be a simple amendment and they're going to be able to extend it to children. I have a patient who was told 8 years ago she had severe chronic lung disease. She was going to die in a few months. She clearly states that she would have taken euthanasia. She's doing very well now. I can't even get her to speak publicly. She's too busy preparing dinners for her grandchildren. So, it's going to be extended, and you're going to start with adults, and already in Quebec, they're talking about children, people with physical diseases, or are going to extend it to people who are suffering mentally. We have the experience in Belgium. People say, well, that's Belgium and Holland. Here in Quebec and in Canada, people are much more honest. I don't think our genetic material in Canada makes us better citizens or more trustworthy than citizens anywhere else on the planet. And the danger is, as countries that are poor will have less facilities, they're going to interpret very much more broadly our laws so that even children with congenital malformations who could be cared for in countries like in the West will be euthanized. Children, why not people who are children who are starving? They're going to suffer anyway. Why not get rid of them? They do it in the West.
Yeah, Dr. Paul, thank you. And Alissa, thank you so much.